It matters health and cases of maternal malpractice and negligence remains high in Kenya, accounting for at least a third of all medical negligence claims reported in the country, according to the Kenya Medical Practitioners, Pharmacists and Dentists Council. While these cases can be prevented, the grim statistics indicate that women and their newborns are still exposed to harm and injury while in the hands of healthcare providers who assume the duty of care to them. In the following report, Gloria Milimu interrogates the impact of medical negligence on maternal health and why Kenya must address the challenge in order to help meet the 2030 SDG targets.
When a patient visits a hospital and consults a doctor, both the hospital and the doctor assume a duty of care towards the patient. And while they go to these facilities seeking relief, healing and successful outcomes, in some instances, that is not often the case, as some may experience harm or injuries, or in extreme cases, even die while receiving care in health facilities. Majority of these cases that occur due to what experts refer to as medical malpractice and negligence impact more on maternal care outcomes, according to data by the Kenya Medical Practitioners, Pharmacists and Dentists Council, a regulating body that investigates professional misconduct and negligence claims against registered doctors and health facilities. Of the 1,919 medical negligence complaints lodged with the council, at least 600 of them are maternity-related cases. Statistics that experts warn further pushes Kenya off track its 2030 Sustainable Development Goals targets.
We see most complaints arising from events that occur during labor and during delivery, where maybe let's say labor is not well monitored, and you end up having what we call a poor outcome.
Victims of these cases, like Robert Omondi, whose wife died in 2022 due to alleged medical negligence, are often left dealing with pain and emotional torture. His wife is said to have died after bleeding profusely post-surgery of delivering their twins. The matter is in court, awaiting hearing on 27th of July 2026.
We are losing approximately 15 mothers who are dying every single day while giving birth. These are not just numbers. These are babies who come to this world, and instead of being welcomed by the joys and the smile from their mothers, they are welcomed by the tears of their fathers.
In Africa, approximately 20 women die every hour while giving birth. 114 newborns are also denied a chance at life in the same period, as countries also grapple with at least 300 under-5 mortalities every 60 seconds, according to data by the Africa CDC.
It means that a lot more investment needs to be done in there. Reproductive and maternal health services.
Experts say victims of medical negligence can explore two avenues for justice: professional disciplinary action and civil suit for compensation. In both cases, time is crucial. Under the Kenyan law, medical malpractice claims cannot be brought after 3 years from the date of which the course of action occurred.
Once, like I said, a complaint is filed, we ask the person complaining to give us all the documents they would want used, or all the documents that can help, including, let's say, for example, the discharge summaries they got.
Overall, medical negligence severely impacts patients and healthcare systems. And in order to ensure that these medical errors don't threaten the realization of universal health coverage, experts advise the need to minimize their occurrence through a collaborative approach that involves both the professional, the hospitals, and patients themselves. Gloria Milimu, KTN.